Ready to do it?
Yes.
Podcast, baby. What's up, everyone? Welcome to Generation 9 Podcast. Your host here with Esan Farahi, Vlad Yudin, Edwin Mejia. Thank you for joining us.
And Mr. Martinez.
Your host.
The Dominican dominated.
So what are the topics for today, gentlemen?
Oh man, it's an important one today. I mean, we've gotten a lot of requests on TRT, and a lot of people want to know more about testosterone replacement therapy. It's a very hot topic. It's something that's been discussed online a lot, and especially on GenerationIron.com. But who better than Vic Martinez himself can explain it? I mean, that's what we want to talk about, Vic. I think people want to hear about it.
Victor right now is inside the Victor. That's my word.
No, again, guys, we're gonna go thorough here with explaining pros and cons. But at the end of the day, there are a lot of similarities to TRT, and testosterone, because they are both derived from the same chemical, buildup, right? The only difference is TRT is not used. They say, again, this is what I read through research and everything else. It's not used for, performance enhancement, meaning not to be as strong, not to be as big, not to be in the Olympia stage, not to be a
Jacked up.
jacked up.
So what is it used for? What's
breaking
TRT?
Olympia records.
What is it used for then?
Yeah, again, these are treatments. I mean, just like testosterone, everything else.
It's kind of like
rejuvenation clinics.
Yeah, it's kind of like a booster, right?
Yes, rejuvenation clinics. If you go,
It's not just a booster. If you don't have such hormones inside your body, especially when you pass after 40, your testosterone level goes down.
Yeah.
So if your testosterone goes down, so many things happen.
What
Progesterone
happens?
comes up, estrogen comes up,
Right.
and so many things happen. It's not just the testosterone. Testosterone is the main hormones inside the man, which is to control so many things.
Yeah, and I see, we know this. So here at Generation Iron, we all know this, but I think a lot of people out there want to know, what is it, right? Because look, I have a lot of friends that are on TRT. Like one day I wake up and they're all telling me they're on it. Yes. I had no idea they were on it. People in finance and here in New York that I know are all on it. Guys in their 30s, guys in their 40s. So the question is, when you go to a doctor, you would need some sort of blood work, right, Vic? So
Yes,
most people know
definitely.
that, but
you need the blood work.
You need a real blood work, or blood
there's a lot
Specific
of
blood
deficiencies.
work.
Specific blood work, full panel.
Yeah.
A full panel blood work. You have to check the blood, otherwise you cannot see the imbalance of how low your testosterone is, your GH levels, everything else. Again, TRT.
Your liver enzyme.
yeah,
Yeah.
why do people get it?
Three things is very important for blood work: testosterone level, liver enzyme, and kidney.
Kidney functions.
And kidney function. Those three has to be basically this check, and then the other side, it's the prostate.
Yep. Prostate.
Prostate test is too. If your prostate and liver it's damaged or not work correctly, you can use testosterone basically. So first it has to be fix your liver and prostate, and then they give you testosterone.
You don't want to put extra pressure on the liver, again. I mean, most of it are injectable, but still, the liver has to be protected. And high blood pressure as well.
Yes, blood pressures.
So what are the symptoms when you feel like you need to
get
extra
a blood,
testosterone?
yeah. In other words, you need to get a full blood panel, right?
You get too emotional.
Too emotional.
You cry a lot.
Really?
You're not horny. You're not motivated. You're
You're
depressed.
not horny. You tired all the
Not
time.
horny?
You're not horny. You're not tired. You tired all the time.
We sound like a commercial.
Are you
Are
not
you not
horny?
horny? Are you experiencing some sort of depression? Are you not waking up
Exactly.
motivated? Are you saying no all the time to
But
your
these are
wife?
real things, though.
Yeah, these are
right?
real
These are
things.
real things,
yes,
right?
yes,
Yes, they
painful. Your body is pain. Your joint start to hurt. You know.
And that's indicator that you have low testosterone.
So
Yes.
Victor, can you just give me a quick rundown? I think that's really good.
Mind you, this is a
What are those things? What are those symptoms that make you think that the people should go get tested?
those symptoms again, like Hassan said, once you start reaching that 40 age, some people different. Some people, experience it later. Some people sooner, but usually 40 is kind of like that marker where you start getting less motivation, and it just starts happening. Less, moody, mood swings, depression. It just starts happening at a certain age, hence the term midlife crisis, You start getting that, and not all the time was a midlife crisis because you were married or whatever, you feel like you're not having fun. It becomes a hormonal imbalance in your system. You start producing less testosterone medically. Again, I have to say again, because many people experience it in some other times. Other people may experience it sooner or later or not at all. Some people are built differently. But for the most common person, it does have the effects of not producing the testosterone or GH levels where you want to feel, in a good mood or motivated. When you actually get this blood work, you see those levels are down. That's when, as much as you can be against steroids, TRT or anything of the sorts, you know what? You're going to be anti-steroids because of your beliefs or whatever. But you know what? You're not going to get better, feel better if you don't get on this treatment. This is basically for everybody.
What are the first steps of it? So let's say you get diagnosed and then the doctor tells you you're low in testosterone, right? And then the treatments, is it an injection? Is it a weekly thing, a monthly thing,
The TRT is spread out a little bit further apart, I believe. It could be once every 2 weeks, once a month. I think the ones that they use are a little bit more time release in the system. Again, it's not the amount, it's not the 200 milligrams amount.
No.
Some of them are, I believe, are like 80.
It's
100
very,
milligrams.
very low. It's very, basically is touching. Before that has to be checked estrogen level too.
Yes.
Some people
Estrogen level? What is that?
Yeah, we have two hormones basically in the body: estrogen and
That's the one you
testosterone.
don't. That's the one you
It's the
don't want.
one you don't want.
You don't want that.
Estrogen, mans don't want estrogen. Basically, estrogen is the woman's hormones, which is the level is very low.
Yeah, the estrogen.
Testosterone is very low, very high. Sometimes the estrogen's level goes very high to become same as level of testosterone. That's part of things need TRT too, which is the CJC.
Yeah.
They block the estrogen, and then estrogen comes down. I mean, I have to add man boobs too.
Yes,
When you
yes.
give
Man boobs.
Yeah, man
Yeah,
boobs.
the gyno
Is that a medical term?
Yes, if you see that,
Gyno.
you need TRT.
Man boobs, bitch tits is more the street name, and but
So would you say if you saw a guy with man boobs, you would recommend TRT right away?
oh man, first I will give him my condolences, and you turn me on a bit, man. No, you have to really. I mean, it's sad, but a lot of times, even as teenagers, when you're going through puberty, some guys go through puberty and they actually get a little gyno without even taking anything.
Yeah.
So again, that's
estrogen pushing that.
Yes.
That's when your estrogen you skyrockets.
So what's an estrogen blocker? I heard that before.
There's a few of them.
CJC.
That's what blocks the production of
a
estrogen.
few of them. It depends.
There's a few over-the-counter blockers that I've seen. I don't know how
There's a
effective they
few, but
are.
other than Novadex, and what's the other one?
Yeah, Novadex.
Rimidex?
Novadex
No.
is one of them.
Novadex
Yeah,
is the
Rimidex.
number one.
That's a
basically.
drug?
Is
Yeah, it is a drug. It's a
drug.
cancer drug.
It's a cancer drug. Yes.
Wow. But it actually became very effective.
So I have a
blocking
question.
it.
Let's say if your testosterone is low, then you get prescribed, and after the first dose, do you feel like your mood goes up? Like after the first injection, do you feel it
Like
right
how
away?
soon after?
Yeah.
It's a treatment. It's a treatment again. You have to really keep going back. You have to.
So it's not an
monitor
instant
it.
thing. It's like you gotta build it up, right?
It depends. It depends. different body. It's all depends on how much your receptor of the muscle accept that steroids. If some people, some athletes, they don't know, they took very small dosage of the steroids, they jacked up because of the reception of the muscle.
I've heard that
it's
before, for
very
sure.
clean and open, and body accept everything. Some people, they don't have that
seen
reception, and they don't have a kidney and liver functional. So because of that, it doesn't matter how much,
Right.
2,000, 5,000 testosterone you put in your body, just they take 100,
So
200.
will a doctor, when you get your blood panel done, will he tell you if your prostate and kidney are in good place for you to go on TRT?
Yeah,
Yes.
safely, if a doctor's a good doctor, he will not give you anything unless your levels are up to par
Got it.
to taking the drug, because obviously they're not up to par, everything's out of whack. He doesn't want to keep sabotaging you.
Sure.
What doctor you have to go for? Endocrinologist?
Normal doctor.
Normal doctor?
Normal doctor.
I don't think you could do a normal doctor.
I mean, a
think-
normal doctor has the license to
They have the license to do it, but
yeah.
you can't.
But
You're not going to go
right
to a general
now,
doctor and get it done.
There's a $500 million a year business, and it's rejuvenations. I mean, those doctors are they're leaving their medical fields and they're opening up their own, the rejuvenation centers, because this is where they're making money. This is what's in dire need.
Right. Because
know.
when I go to a regular doctor, they're
scared.
And I ask them, hey, I want to get my blood work done, full blood work. They're like, oh yeah, we'll just do a regular blood test. But then you see your creatine, you see those like your cholesterol, but it's not really your blood panels, Victor.
No. Again, those doctors, I'm not saying they're bad doctors, but when they're not educated in the whole, taking testosterone, they're always going to downplay it.
Got
They're
it.
always going to speak negative because all they know is the negative effects of it.
Is it taboo or something to TRT?
Yeah,
It's not it is
doctors
taboo?
are scary. It's kind of like, right now, if you go to a doctor with, crazy pain, you ask them to just give you something for your back, a perk, they'll run away from you. It's like testosterone back,
Yeah. They want no
Now-
liabilities.
they don't want any liabilities, anything of the sort.
Testosterone, it's very tricky drugs, because when you use it, your blood pressure goes up. And the other side,
From TRT, really?
yes, no matter what, testosterone brings your
wow.
blood
Both,
pressure
both,
up.
actually.
No,
So
no matter
that's the
what.
con. Like, pros and the
Yes.
cons. That's definitely
Yes.
the con.
Yes.
So before that, that's why the doctor, it's very, very careful to
I had
give
no
the
idea about
testosterone
that. Wow.
to someone, because the testosterone gives you blood pressure, and blood pressure gives you so many
Problems.
effects,
It's dangerous.
and dangerous. And the other side has to be check the liver before that, and kidney, because liver, kidney, it's both involved with the testosterone level inside the body. It's very, very tricky. That's why the doctor not give the testosterone easily to anyone. First, because of the blood pressure. See, when you go to doctor, the first thing the doctor do, they check your blood pressure.
Yeah. Right
They're
away.
not talk
right
to
away.
you. They are not talk to you before the
That's the first
blood
thing.
the
pressure.
first
thing,
thing is
yeah.
blood pressure is the most dangerous things, from the heart attack.
can kill you.
For everything.
Stroke.
Everything.
Sure.
So because of that, I mean, any drugs involved with the blood pressure, doctor hesitate to give it to anyone.
That's interesting. So is it expensive?
It's not that expensive. I will have to say most of them do have a $200 a month. Again, they're not giving you that much.
Yeah.
Yeah, you don't need that much.
Yeah, they're not
basically.
giving you that much, so therefore, they don't really charge you that much. So,
Well, they can only prescribe you what you need. They can't just, right?
exactly
What your
only
body
what you
needs,
need.
right? Exactly.
Yes, I mean, are there a few rogue doctors? I mean, maybe.
Well,
But,
they get in trouble. Like a lot of those clinics.
I
right?
mean, they only get in trouble if they tell.
Right.
Again.
Well, Florida's the wild, wild west.
Yeah,
right?
yeah. Florida's the
Florida's
Wild West
crazy.
when it comes to that. And again, if you're feeling good, looking good, are you gonna rat your doctor out? I don't think so.
Maybe competition.
Yeah. For the most part, you don't want to lose your doctor, and you're screwing yourself. But when something bad happens, that's when the doctor, is really scared of, and that's when he refrains from giving you anything any further. So he wants to stay within that realm of healthy, making you feel better, and having everything on the chart
Sure.
to cover his ass.
And
So
have you've seen guys transform, Vic, after TRT?
That's a good question. Yeah.
TRT, again, if somebody has not used testosterone and they go on TRT, do you see them different? Yes. Yes, they do feel the difference. I can see the difference because
Physically and mentally both.
physically and mentally, and that's what the main thing is for TRT is it's to
But next to the TRT, you have to active too. You have to do activity, either bodybuilding, running, biking.
Yes.
Some kind of sport.
Have to, yeah.
you
if-
have to. It
yeah.
still causes a clot. It still causes
Clot,
the
blood
hair
clots?
loss. It's still every side effect you get from steroids. You're still gonna get it.
Really?
Yes.
From TRT
If
is
you're not
still-
if you're not active enough, all the side effect comes to your body.
Let's talk about all the pros and cons here, because I want to make sure people can make the assessments.
yes.
So let's talk about all the pros.
Okay.
So sex drive goes up, yes?
Sex drive again.
Oh, no.
Yes.
yes.
Definitely.
will go up.
Definitely.
That's a
definitely.
positive, yes?
Yes, it is a
Definitely go
positive.
up.
So you can make love again.
I mean, guys, you got to
That's
do
good.
that, you know.
Okay, you can.
That's
let's-
why all the girls love the bodybuilder.
Well, some,
I'm not.
unless they
that's the
broke,
fact.
then you're still just broke.
what are the pros? Let's talk about all the pros. So you feel more motivated, right? Mentally, you feel
You're
like
not tired at all. You not get tired easily.
Yeah, as fast.
You can lift heavier, right?
Not as heavy again. Now,
No.
taking testosterone, yes. TRT, not as strong. You know, that's why Larry, you're still lifting kind of heavy still there, bro. Is it TRT?
All right. So what are the pros?
As soon as your testosterone level comes to the normal, as a age you are, because each age is different level.
Yes.
Yes. As soon as this one comes up, and GH is a one part of the TRT.
Yeah.
It is.
Yes.
It's more in the endocrine system.
GH, and some doctor I see they give him the IGF-1 too, because IGF-1 is a same things. It's a testosterone and GH,
Yes.
and touch up the little bit insulin, which is we can eat more food to build up more muscle. So
Yes.
some
TRT
doctor
increases the appetite. Yeah.
yes, some doctor give the IGF-1, which is it's a combination with the three drugs: testosterone, insulin, and GH.
Insulin.
Yeah, very very tiny. But again, you have to check your body. You have to your doctor tell you exactly what you need.
But what are the pros? Okay, so what are the pros? Sex drive, a little bit more endurance.
Yeah,
What else?
you basically get your mojo back, you know. Get that confident, you know. Also mentally,
You're back to 25.
stable. The psychological effects of, low testosterone is really debilitating for a man. You know, they're just not gonna have that, that drive to want to do anything. And TRT helps with that. So you want to combat this feeling, these negative effects. So yes, you have good mood, you feel better, the energy, fat burning as well. I mean, what else do you want?
What are the cons?
I mean,
The
Hair
high blood
loss. You said hair
pressure.
loss, blood pressure.
High blood pressure,
Yes.
hair loss. You cannot go off it. Now, guys, we have to emphasize this.
Cannot
This
go
is
off it.
a lifelong treatment.
yeah,
So once you start
This is
TRT,
once you
that's
start,
it.
yes,
There's no getting off.
Oh wow.
Once
There's
you're
no
hooked.
getting off. Otherwise, it's gonna hit like the stock market back in 2008.
I hope
Wow.
I hope the people right now, because of they get tired or sex drive, not go buy a testosterone and inject himself. Don't do that, guys. Don't do it. This is the worst thing.
Yes.
You got to get it
can do
prescribed.
it. I mean, right now, because right now we're saying if you're
right.
tired, if your sex drive is low, if you're
Those can be
if-
misunderstood.
yeah. Sometimes your vitamin D is low.
Yeah.
And you get tired,
That's a good
and
point,
it's exactly the same feeling.
If
when
your vitamin D.
when vitamin D go down, specifically in the winter, and you don't have sun enough, you not reach the vitamin D, because vitamin D is that vitamin you cannot reach in the food easily. It mostly comes for the sun. If your vitamin D goes down very high,
feels the same as low
it's the same effect. you feel very tired, your sex drives goes down.
Yep.
Sometimes you can fix those feelings just for vitamin D. Don't go and buy an testosterone just because of your sex drive is bad or you're tired. You have to go to the doctor.
That's a good point.
And doctor check your all body, kidney and liver, most important part of the body. It's if they get damaged, you're done.
Yep. And for the negative one, again, your nuts, same thing. TRT, testosterone have the same effects.
Your nuts?
Permanent shrinkage.
It's the same.
Just happens. It
It's
just
the same.
happens, guys. Is that the end? No, it's not. So just, again, get the blood work, be careful, get monitored. Again, like Ehsan said, you do it on your own. It's just, you're asking for a recipe for disaster.
I'm looking at the TRT as some person is sick. When you get sick, for example, you get flu, you go to doctor, and they give you a flu shot.
Right.
I don't know, and it's some drugs for that sickness. If you're not sick, don't use it. TRT, it comes from if your hormones balance, it's not balance. If your GH, if your estrogen, if your testosterone, these three, just the doctor check those three. If those three is not balanced, they give you a medicine to be balanced. TRT basically balance your hormones in your body, nothing else. So I'm looking at the TRT. If someone goes for TRT, that person has to be sick. So
Yeah, pretty much all their levels not good to a point that you're just unmotivated, Testosterone, again, you take something that's 200 milligrams of the sorts, you're gonna get bloated, you're gonna have the extension, you're gonna have the water retention. TRT, you don't do as much, so therefore your retention is gonna be very minimal. Your swollenness is gonna be very minimal as well. So the amount of TRT is so little compared to just taking testosterone for competition.
Is it better
we have such a thing as a professional bodybuilder do that after the cycle. We call PCT.
Yes.
PCT is kind
Post-cycle
of like
treatment.
PCT is kind of like a TRT to be balance your body. I think Victor can explain better than me.
Yes. Again, right when you get off, again, you get on testosterone, not the TRT. When you're on test, you just got off a show.
Cycle for bodybuilder.
The full juice.
Yeah, cycle for bodybuilder.
You have to go on a little PCT again, so you won't aromatize. You don't want to have the estrogen level just skyrocketing as you get off. So that's when you go on the treatment, ACG, Novadex, and the sorts, and
little bit testosterone. You know what happens
just a
when you
little
go
bit,
when
so
you
don't
go
crash.
to when you go to cycle for bodybuilding,
Right.
your hormones go to roof. Maximum your body can
You're taking so many
handle
different
it.
things.
The max level your body can handle it, you bring it up. And imagine that person took 1,500 weekly testosterone, So after that, I know somebody 2,000, that's crazy part. But after that, when you stop, you have to balance everything. Slow, bring it down. If you stop right away and go back to normal life,
crash, basically, right?
you kill yourself, basically.
Right.
You toxic everything, everything is affect.
So let's draw a little conclusion to the TRT conversation, right? So is the risk worth the reward? Is it better to be on TRT, taking a risk, as opposed to living a life with low testosterone, right?
You're 45, 50 years old. You have all your kids already. You're doing well for yourself. You want to enjoy the rest of your life without having to worry about these chemical imbalances or mood swings. Why not? Why not? As long as it's safe, you don't have any issues in your liver, your organs, why not? I don't think it should be anti-treatment, because at the end of the day, we have a small time on this earth. Let's live it up, live it well, and enjoy it. So I think it's not bad, and I think everybody can decipher this. And look who's doing it. Again, most of the people that are doing TRT, are not even past athletes. They're just your everyday working men. Yeah.
Yep.
And there you have it.
If you, I mean, I want to close this. If you go to doctor because of exactly what you say, your mood, your sex drive, your tiredness, if your testosterone low, don't scare if the doctor give you testosterone and they tell you you have to go to TRT level of juices. This is not juice. This is exactly what you say. This is treatment.
Right.
Some people need it. After 40, 45, you have to check your body every 3 months, specifically testosterone.
Every 3 months.
Every 3 months, you have to check it because you don't know what's going on last week, what happened. Your body is collapsing
Right.
every year, every 6 months, every 3 months.
Right. We don't promote steroids on this podcast at all. But
Not at all. No
Unfortunately, you know, a lot of the audience, they dabble or they want to dabble in it, right? So I want to talk about top mistakes that especially first-time steroid users might be committing, right?
Yep.
Now, we got a little list here. I want to run it by you guys and you tell me what you think about it. So correct me if I'm wrong. There's some steroids are injectable and then there's a variation of digestible steroids, right?
Yeah.
Is
The
that
orals.
Oral steroids. Is that true? And are they safer than injectables or are they more dangerous?
Again, the safest oral steroid might be Anavar, and it's a mild steroid. A lot of men and definitely a lot of women, you know, do use this. It's one of the safest one because it doesn't affect your liver as much. So it's not the amount of, let's say, D-ball or Anadrol, so alkaline 7.
So not every steroid is available in oral form, only some.
No,
No,
only some, unless they have one testosterone. It's in a gel, and it's
In a
actually-
gel?
Yes.
Like a topical?
Yeah. No, I mean they have. Yes, they do have.
Wow.
Yeah, you rub it on your skin, but you know what? If you have kids, you have a wife at home or anything, you hug them and you have it on your skin. That actually transfers. So,
It's work for the old people,
Yeah.
past 60, 70.
yeah, it's not bad.
You know, when you pass 60, 65, you cannot inject testosterone because,
Why?
again, blood pressure goes up.
Yeah,
blood
blood
pressure.
clot. Yep.
Blood pressure goes up. So the gel, which is Victor say, and sniffing, you know, something from sniff,
It's a nasal.
nasal.
Yeah.
Nasal steroid.
Yeah, nasal is testosterone. Yeah, we have nasal testosterone, we
crazy.
have gel testosterone, and we have
The
pill.
pellets. They have pellets too.
Yeah,
What's a
Which
pellet?
is a pellet, inject it, and it breaks down in your system on
Wow.
time release as well.
So if you're over 65, that's something to consider.
it's
basically.
very
Yeah,
dangerous
you don't
because
want
of blood
frequent
pressure.
shots. You don't want frequent injections or anything.
But like injections, right? Like that can go wrong too, right? Injecting constantly. Like,
Injecting, a lot of people don't follow the simplest protocols with injection. You know, cleaning the site, letting go of the you know, releasing some of the air in the syringe and all that. I heard freak out stories where they will inject it either with too much, a combination of other steroids, or just not clean enough. You know, they don't follow
get an
the
infection
OSHA
like that, right?
practices. You get the infection. That's why any of you guys out there that are doing this at home think you have it down pat. We're using the same needles. I wouldn't recommend that. It's just have a few antibiotics handy. Just have them. I mean, it doesn't hurt you. At the end of the day, when you do have the infection, and how do you know you have the infection? Discoloration of the skin, its sensitivity, starts getting hot. And if it starts looking purplish, yellowish, it's not a good sign, you know. So take something like have Biaxin or Cipro handy. It just doesn't cost much. But if you wind up in the emergency room, it will cost you a ton. So you can save a lot of money by just having
what's a buildup of fluid?
antibiotic.
Building up fluid. That's one of the things
Yeah,
that,
that's the buildup of fluid.
in the injections, like
Yeah,
place.
that's just when you take the shot. A lot of people, again, I know a friend of mine back in the day who just take one shot of Winstrol and he had the most amazing reaction. One shot, I swear, he did a show taking only 4 cc's of Winstrol. I don't know how he did that, but again, he was a super freak. You know, I know somebody else who took Winstrol, same injection on the shoulder. The water retention was just so ridiculous. He had an adverse reaction. This could happen from any oil base, any water base, testosterone. And once you get that adverse reaction, that's when you have the edema setting in. Your ankles get swollen. You get this just unwanted water retention. And what do you do next to try to fight it? I would suggest you stop. Most people think they could take a water pill, and that also leads to another issue, you know, when you take.
It seems like one issue causes another issue.
Yeah, again, that's just the self-fix when you do it at home and you don't know, or you're just following social media advice and not, you know, going through a medical professional. So that's when you have to just stop, you know. You start feeling sensitivity on your nipples, just stop, you know. Could this be bad? But they think, oh, I don't want to stop. I'm getting the right gains. I'm looking good. I'm strong in the gym. I suggest you stop because it might not, you know, just be you. It might be this particular steroid you're taking. So just stop taking that one. Switch it up. There's so many in the market. There's so many you can take, you know. We're not going to go through the whole list here again. We're not trying to promote.
We're not promoting that at all.
Yeah, we have
Safety
we have a lot of level fast active, long active, water based, oil based, and oil based is a little bit dangerous because of they have lead on it, and lead it's basically damage your body, be painful. If yours they say is not clean. So if not clean, the lead
oil,
is too much. Yeah.
The oil that is compounded with, it could be cottonseed oil.
But all these steroid compounds were made for something completely different than people use it for in bodybuilding, right? Like
I think the Nazis made this. You know?
Yes.
They could be
Did they
more
really?
aggressive. Yeah.
Yes.
The Nazis.
like you mentioned, one is a cancer medication. Cancer medication. They use it for
All of them.
It was used for AIDS. A lot of AIDS patients for
build strength.
Yeah. So they couldn't lose the muscle.
Yeah, testosterone and GH is from the AIDS. Basically, testosterone they give you build up the muscle, which is exactly when you get AIDS, you lost muscle.
Also, when you get burned, right? They give you steroid and burn victims.
Yeah.
Yeah, burn
Yes,
victims.
yes.
They use a different kind of steroids, yes, to actually, you know, regenerate the skin and help heal faster. Post-op, the GH helps a lot. Post-operations for tendon healing and all the sorts. But there's so many pros, but remember the negative effects that people show in the news or anywhere else with steroids is because of the abuse and teenagers using it too soon for high school sports. So the news reported so the kids wouldn't take it. They don't want to look up to a baseball player hitting home runs because he skillfully is hitting home run. They attribute it right away to steroids.
Speaking of baseball, isn't it crazy how remember Barry Bonds? Barry Bonds was like the man. Like he was hitting home runs every day. And then like when he retired, people like
Barry Bonds
looked down on him. But then I'm sure others were using it just as
it was
Everybody was-
creatine, man. It was
those are the good days.
allegedly. Okay, he was allegedly on steroids, right?
It wasn't proven. It's an asterisk,
Allegedly,
though.
allegedly.
Like the whole
Against-
world, the sports world kind of just like they shunned him. You know what
I
I mean? Like,
believe. I believe if you
messed
want to
up.
go to next level of professional athlete, doesn't matter which sport, you need something.
some juice.
You need not juice, specifically juice. You need something. I
Well,
mean,
now they're taking peptides. There's like a gray area in the peptides.
Yeah.
Like not
SARMs.
so
SARMs.
SARMs. Again, there's a lot of gray areas, but I think the baseball organization and other athletes added a lot to the list. I don't think they can even use ACG or even.
Really?
No, they can't do ACG.
Can they be on TRT, baseball players?
No,
No,
I think that's
yeah,
on the
that's-
ban
that-
list.
Even
That's
TRT, like
Yeah,
prescribed?
no, that's banned. Yeah, that's all banned.
Really?
Yeah.
So the question is the band. Is a band,
Well,
okay.
well, A-Rod was on TRT.
I believe it's a
mean,
band.
allegedly, but he
While
was on
playing.
TRT.
You know, GH is a band in the soccer too. But Messi used GH since he was 13
Allegedly
years-
or
Allegedly.
He did because I think he had a
He had a problem.
stunted growth or something.
Yeah, growing up. So he used in GH since 13 years old.
to grow.
Someone like me
For
is
the
gonna
growth.
say that's why he's so good. Nah.
So
That's the only
and
one.
He's got skills.
GH the best recovery.
Yes.
Basically, GH make you recover to go 100% tomorrow again. So, come on.
It's
So
I mean-
even when you get knee replacement surgery, you get like recommended steroids too.
knee replacements. I
Yeah.
mean, a lot of sports athlete football and all that. When again during the window of their healing process, do they use it with approval of the NFL? No, yeah, but once they're playing, can they be on it? That's again, we don't know that. We don't know that.
So a pre-workout with TRT and a steroid is a great
TRT all day,
combination. It's a
pre-workout,
killer
you
combo.
crash and burn.
You know, he said something very interesting. The kids in right now, teenager, 20s, they go to online and see, they hear some drugs. Oh, I want to become look like him. I want to become look like him. Because of that, they read on internet
Well.
combination of the steroids, which is that age you don't need it. The level of your hormone is in the roof.
Right.
So you don't need it. So abuse it, exactly what he said. They go into next level, abuse his body to become champion or bodybuilder or anything. And after that, body and muscle reception is not accepted anymore of anything.
Yep. I say basically, if you're in high school, you should be looking at weights and really getting your best gains because you're at the best time of your life. And if you do use steroids, I'm gonna tell you this right now, you're in high school,
You're done.
you're gonna be okay. You're gonna have a little fun. You're gonna look cute and all that, a little bit of muscle. But guess what? The second half of your life is gonna be horrible, man, because you're gonna have such a crash. You're gonna have
After 25.
Yeah. After 25, I mean, I know a guy 28 who used steroids at 18, and he couldn't get a hard on, man. And
Yeah, I believe it.
you know, I mean, man.
That is not a good look.
I mean, the only reason I had his girl because he was still spoiling her. But other than that, it wasn't sexually spoiled. It was
Got a
more
Birkin bag.
shopping spoiled. That's
So there's
it.
there's two things women will leave you for: money and what was the other one?
Yeah, money, and what else? And dick. All right, guys. Thank you for joining us in Generation Iron today. Don't forget to follow us, and
Be steroid free.
yeah, steroid free, guys. I mean, come on, push it as long as you can, man. Guys, you can listen to all our episodes on Spotify, Apple Podcasts, Google, and iHeartRadio. Join us next week.